Okay, so we are talking about Chapter 8, cardiovascular diseases. How do I get over to it? Okay. So the first one we'll talk about is arteriosclerosis. It is a progressive degenerative disease of the arteries, commonly caused by buildup of fatty plaque or erythema. So that is a picture of an artery right there, all clogged up with fatty plaque. You see that little part right here that's breaking away. That's why that causes a problem, because that little piece breaks away and it gets lodged in an artery in your brain or your heart. When it happens in your brain, it's a stroke. When it happens in your heart, it's a heart attack. So they want your arteries clear of plaque, because that's what leads to heart attack and strokes. Arteriosclerosis, possibly affecting any artery, but most commonly the coronary, which would be what organ? Where's the coronary arteries? Anybody? Somebody knows. Huh? Coronary is your heart, yes. And carotid would be right here, yes. So they causes wall weakness, loss of elasticity, and blood clot formation. Arteriosclerosis, the treatment is pharmacological, which means medication. So that you can take medication to decrease your cholesterol level. You can take medication to thin your blood. And you can also have surgery if it's bad enough. Endarterectomy is a vascular bypass surgery and a stent. We'll talk about that more when we get into the procedures. Okay, so that's arteriosclerosis, basically clogging of your arteries. Next we move on to coronary artery disease, or CAD. So any disorder of the coronary arteries that affects their ability to deliver blood to the myocardium. Myocardium is what? Myo means muscle, so it's the heart muscle, right? So you can see right here, this little coronary, on the outside of the heart lays these coronary arteries. Depending on where they're at, like we said, you know, how much of the heart is affected. But this artery right here is clogged, so all this right here is not receiving enough oxygen. That's called ischemia, when it's not receiving the oxygen it needs. And then eventually that area infarcts or dies. Okay, so right here we have a coronary artery. This is just showing partial. You can see you still have kind of a little bit of an area where blood's flowing through. It's not completely occluded, but it's partially occluded. So they'd probably say that that's, you know, when they went in and did a cardiac cath, they would say this artery, this coronary artery is maybe 30% blocked. Okay. And now we have this one. Total or almost total occlusion of coronary artery results in death of tissues, a condition called infarction or necrosis. So in this place, you can see all we got is a little, very small area that's letting blood go through. And so this area of the heart is this is coronary artery disease showing almost total occlusion of the coronary artery. So no blood's getting through there, which means no oxygen's getting to the heart. So that area of the heart is not just ischemic and low on oxygen, it's actually dying. Most commonly caused by arteriosclerosis, possibly blood clot formation or rupture caused by plaque. CAD is coronary artery disease. Risk factors for coronary artery disease are smoking, stress, physical inactivity, family history, diabetes, obesity, elevated blood cholesterol. So which one of those is you can't really do much about? Family history, right. And your family history could also have where you run with high blood cholesterol too. You can do something about smoking. You can find better ways to handle stress. You can, unless you have some kind of physical condition where you can't do activity, you can increase your physical activity. Diabetes, if you have it, it's not that just means you have to keep it under control. People who don't keep it under control do damage to their heart and their kidneys and their other organs. Same with elevated high blood pressure. With high blood pressure, it has to just be kept under control. Obesity is something we do have control over. Some of it's easier for some than others, but as you get older, obviously your metabolism slows down. So signs and symptoms of coronary artery disease, or CAD, anginal pain. Angina is the medical term for chest pain. So they're saying chest pain there. Shortness of breath, diaphoresis. Anybody know what diaphoresis is? Nope. Yes, no. Diaphoresis is when you're just having profuse sweating. So if you've ever taken CPR, there's a video where they're all kind of covered with beads of sweat, and that's somebody like that is diaphoretic, or has diaphoresis. Pallor is just pale. So somebody with coronary artery disease probably doesn't have the best color. They may look a little pale, a little grayish, just because their body's having a little too hard to get oxygen to your heart and organs. The treatment for coronary artery disease, surgical intervention. So the first step they would do if you're having chest pain or angina, they would probably say, okay, maybe we need to do a stress test. So they'll do a stress test. If you pass the stress test, then they probably won't do any further testing. If you fail the stress test, they're probably going to say you need to have a cardiac cath. And so that is a procedure where they go in and they look at your coronary arteries and then they see if they are blocked. And that's when they say, oh, okay, you got this one 90% blocked. And so depending how urgent it is, they may say we can put a stent in there and clean that out. Or they may say we need to do open heart surgery and do the bypass graft. And we'll talk more about bypass graft. But there are two options. If it's not a very big blockage, they put a stent in. If it's a really big blockage, they have to do open heart surgery. And then they would take a graft from a different artery in your leg. Usually it's the femoral artery. And sew it in and replace the one that's completely clogged in your heart. And they do that. That's the one where they use a saw, cut your chest open, and do open heart surgery. Okay, so that's it on coronary artery disease. And you want, like I said, we got chest pain, we got stress tests, we have cardiac cath, and then open heart surgery. So all these things is better to find this out before you have a heart attack. If they find this thing out, if they go in and they see you're 100% blocked, then they've saved you before you had your heart attack. If you've had your heart attack, then it's a different process. Okay, so an aneurysm, you've heard that term before, is a local dilatation of an artery. So when something dilates, it gets bigger, and when it constricts, it gets smaller. So your artery's going along, and you just have a weak point in that artery where it just kind of balloons out. If it balloons out far enough that it gets thin enough that it has the potential to rupture. And when an artery ruptures, because it has a pulse in it, it's, you bleed out very fast. So it may cause thrombus formation, hemorrhage from rupture, or ischemia, which is, again, the low oxygen to the area. Commonly located in the aorta of the abdomen or chest in the brain. So often we hear where they've had an abdominal aortic aneurysm or they had a brain aneurysm. The brain aneurysm people are often the people that fall asleep, don't wake up. They just have an aneurysm at night and they just find them and they never wake up. The abdominal aortic aneurysm, if you are lucky enough for them to find it, they may be doing an assessment on your abdomen and see a little bulge and then say, oh, that bulge has a pulse. And then they know that they need to do something about it pretty quick. So 3 types of aneurysms. The first one there is the fusiform. It's spindle-shaped. Both sides of the wall have just kind of relaxed a little bit and spread out. Saccular, it's just like a little bleb, like a little hemorrhoid coming out, except that it's in an artery, not a vein. And Dissecting is where the actual wall of the thing is broken, and this is blood pooling into the outside of the artery. Signs and symptoms, possibly asymptomatic. In a slender patient, a pulsating middle and upper abdomen mass, that's what I was talking about. Mild to severe weakness, sweating, tachycardia. What's tachycardia? Anybody? Tachy is what? Fast. Cardia. So that tachycardia is a fast heartbeat. And hypotension. If hypertension is high blood pressure, what's hypo? Low, yeah. So the treatment for an aneurysm depends on the location, size, the likelihood that it will rupture, and the general physical status of the patient. An aortic aneurysm, they're going to do an endovascular stent and a graft surgery. They'll cut out that weak part and put it back together, kind of like an anastomosis. Open surgical treatment and place a graft. A brain aneurysm is reserved only for cases that pose a high risk for rupture. So they may find a brain aneurysm before it ruptures, but they're not going to go on doing brain surgery unless it looks like it's high risk for rupture. Okay, so that's it on aneurysm, and those have to do with arteries only. Varicose veins have to do with veins only. So they're twisted, enlarged veins caused by pooling blood in the veins, especially in the legs. Pressure on the valves from blood overcoming gravity on its way back to the heart. So the blood's trying to get up to the heart. Those valves are weak, so it's just kind of dropping back down and leaving little bulges in the veins. So this is a normal vein, and this is one that has a weakened valve. So varicose veins, their common locations are in the lower legs, esophagus. So esophageal varices, not necessarily always, but very often esophageal varices is somebody who's a chronic alcoholic will get esophageal varices. And sometimes those will rupture as they start throwing up blood and stuff, and they found out later that they had esophageal varices. And then also varicose veins in the rectum are hemorrhoids. So varicose veins, there's a picture of what they look like. You can see the veins, they're just full of old blood. Engorged, twisted veins of the legs. So they do cause pain. They do cause edema. Anybody know what edema is? Edema is swelling. And they can cause skin ulcers, a burning sensation, and itching, because your skin's just tight, your skin's stretched. The treatment, lifestyle changes, avoid long periods of standing, elevating legs as much as possible, and wearing compression stockings. I would recommend anybody who stands on their feet all day to wear compression stockings. Anyway, at least knee-high. A lot of nurses that work 12-hour shifts wear the compression stockings, at least knee-high. If it gets bad enough, you can have surgery, sclerotherapy, laser ablation, or radio frequency ablation, ligation stripping. They go into that procedure a little bit more in the next section. And that's it. Did that answer all your homework questions? Anybody have a question?
Pulsating mass in the patient's abdomen. A pulsating mass in the patient's abdomen.
Would be a aneurysm, aortic aneurysm. Define what? Erythema?
Yeah.
Is that what I don't remember putting that one on there? Oh, arrhythmia. That's a irregular heartbeat. Yes. Okay, that's it.